Hello, everyone. I hope everybody's doing okay today. In today's episode, we're going to talk about stroke treatments. So, before we get started, please like, subscribe, share, follow for all our new content and anything that we need to answer for you. Please get in the comments and let us know what questions that you have for us, and we'll try to answer them as best as possible. So, today's episode is titled "All About Stroke Treatments," and by me, Will Gray III. So, let's get started. In today's episode, we're going to cover 3 points. We're going to talk about what is a stroke, types of strokes, and treatments for those strokes. Now, let's start with what is a stroke. For everybody who's unaware, this is a very, very simplified definition of what is a stroke. A stroke is when the blood supply of the brain is cut off or lost, and it's caused by basically um, a clot or either a breaking in a vessel. This causes the cells in that area to die. So for the most part, when strokes happen, they happen at some level of the brain or brain stem. Those actual cells in that area lack oxygen, and as a result, they die, and then you lose some type of function. Now, types of strokes. There are two types of strokes, and both of them present differently. Okay. In my opinion, the most detrimental stroke that you can have is the hemorrhagic stroke. An ischemic stroke is pretty tough also, but it's a different type of issue you're having here. You're having a clot stuck in a vessel. A hemorrhagic stroke, you have a bleed, the vessel has ruptured. So with that occurring, sometimes when it happens, you have to have a brain surgery of some kind to repair the vessel. But sometimes the vessel clots off and you're able to not have that procedure, which can lead to other effects or other quote unquote degrease control with certain motor movements. So, types of strokes: ischemic stroke occurs when a clot happens, which cuts off the blood supply to that area of the brain or the brain stem, and or hemorrhagic stroke when you have a blood vessel that bursts and bleed profusely, and as a result, you lose the blood supply, which has the oxygen, which supplies the brain, and that tends to give you some of the worst outcomes as far as like how a patient presents and recovers. But I've also seen the outcomes be good too. So some of that stuff just speaks to the fact of how malleable the brain is. Now, let's get to the treatments. This is the part that really excites me. Due to the fact that I'm a DPT and I specialize in different aspects of therapy just due to my exposure and experience. The one thing that I like to discuss is traditional treatments versus non traditional treatments. So, there are a lot of different types of approaches to treat strokes using PT. There just is, it's a bunch. Neurology is still a pretty new science in reference to the sciences that we have that exist already. Neurology is still a little new. So as a result, a lot of people don't know as much as you think they know about it. They have a pretty good understanding of certain pieces, but sometimes, even with that understanding, you can't explain how the brain is able to actually adapt, change, to be able to evolve, to still allow you to have certain functions, even with damage to it. Now, in a traditional setup, there are a few facilities I'm going to mention. Neuro rehab facilities. Look at that spelling area. Nope, not changing it. Long term acute care facilities and home health, which are optional. And I'll speak about home health as being the optional piece in a second. But the neuro rehab facilities that are present, they specialize in a lot of acute level strokes or traumatic brain injuries or spinal cord injuries. So they're very specialized early in the process of getting the patient to be stable, mobile, and start to basically set the foundation for them to return to some level of function. Now, the next thing is a long term acute care setup. Kind of the same thing, but not, right? Long term acute care setups is when you have clients or patients that are very sick and or they've suffered a neurological injury of some kind and they're not able to transition to a neurological rehab yet, right? So they're right there in that spot of they're on the vent, they're suffering, from pneumonia, or maybe they have that traumatic shock that happens post neurological insult of any kind in that long term care acute facility is very important to get them stable enough to be able to do more, right? So, super, 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 super important. Now, the home health option, when I speak of it, there's different strokes for different folks. The home health option itself has some, how can I say, flexibility within it. When you have a neurological issue, especially a stroke, they come in, do a good job of making you mobile within your home. Some of the home health therapists are better than others. We all have that throughout all professions. Some carpenters are better than others, some plumbers, mechanics, surgeons, they're just what it is. But you could find options within home health that could get you foundationally set up. Okay. Now, let's move to the actual non-traditional setups. The reason I wanted to talk about this a little bit more in depth is because this piece is the piece that not many people can quote unquote give you an exact quote unquote approach. All right. So I say non-traditional. Not many outpatient clinics are set up to handle stroke patients. Most outpatient clinics are pretty much not neuro, but orthopedics and you know, like back pain, things like that. So they're a lot more, how can I say this, joint to slash maintenance related. They're not really in a situation of progressing neurological clients of any kind. That's me being honest with you. If you don't believe me, just find someone who's had a stroke before and they'll give you your experience with an outpatient setup. They're pretty much going to say that they were doing some of the same exercises throughout the whole time. There was not any specialization. And it's not really a surprise because they don't specialize in that. Uh, a lot of them are working with people who can walk in the clinic and walk back out and go home. You know, so that's pretty much a thing now. But you do have specialty outpatient setups. Those specialty outpatient setups don't necessarily have to be neuro specific. They can have therapists in those settings or a therapist in that setting. That's a very elite and attention. Um, how can I say this? Focused when it comes to how they treat the clients that they have. So meaning that they will definitely um, figure out specific issues you have and deficits and focus. Now that leads to the next part, the private PT practices. Usually you find a therapist or therapist, plural, in private PT practices. You're either going to find some that can do the job really well for neuro strokes, or you may not. That's where the non-traditional thing comes into place. They exist. I promise you they exist. You just have to quote unquote find those people and lock in with them. They can do an exceptional job. And the last piece is your concierge service. When I think of concierge services, this is not home health for me. This is more of a different setup. This is more of an exclusive slash very, very, how can I say this, specific type of need. That's perfect is the way to say it. Maybe you have people who are not able to get back and forth, right? But they need an outpatient feel in a home setup. Maybe you have people who are people of note. They're not going to be in and out of, populated therapy setups. They want to do it in their home because of the privacy piece. They don't want to know people to see them and bother them and things like that. Maybe they're an athlete, maybe they're a governor, maybe they're somebody of note, right? So those concierge setups tend to sometimes, with their exclusivity as far as like what they're specially set up to do, you end up having people who come to your home who do an amazing job with your actual, rehab because they have a different approach. They're not getting in, getting out. They're getting in because you're paying them to get in there and they're going to really, lock in. Not all of them, but you can find ones that do. Now let's kind of progress forward. Neuro rehab focus, right? The reason I put this in here as far as a treatment on the non-traditional treatments is because years after your stroke, there's a certain approach that you have to continue to have. which is you have to be in a quote unquote neuro re-education approach. You have to always think about the brain as an actual computer that resets every 48 hours. So you need to try your best to see if you can overexert and over quote unquote load certain parts of the client or patient body that has the deficits. And a lot of times it's motor planning. It's the brain that they're having an issue trying to get to do certain things. But they can move things on command. If you ever looking at somebody and you trying to figure out what's the deal, how do I approach this neurological issue when it comes to a stroke, neurological re-education on steroids have to occur. The most important part, by the way. A lot of people get away from it after they get a patient that can sit up, transfer like, okay, we're doing neurological, re-ed. We're just trying to, just walk around and do the activity many times. No, you have to target and figure out why they're not able to quote unquote advance their limb properly. Have you restricted them in certain environments to say, okay, you can't go left or right, you can't swing your leg out, you have to go straight ahead, very tight area to get through. I'm going to make it safe, but we have to do this and think about how we need to do it. Let's look at the motion. Let's break it down. In most outpatient setups, they can't do that, which is why the traditional outpatient setup doesn't really exist. That's why I said before, it's very hard for it to exist. They're trying to make them happen, but the amount of time it requires. Right, a lot of people are trying to get see 3, 4 at a time. And that particular setup is slowly but surely starting to be uh, a dinosaur in a sense. All right, now here's the last part of the talk: identifying what is the muscular deficit. If you're unable to identify what's the muscular deficit, you're not going to be able to help these people with strokes. So if you're a person that has a stroke, all right, if the person that you're going to can identify your muscular deficit and make it improve, it's not going to help you. Sorry, not enough leg kicks and butt kicks to help you. There's certain things which I'm not going to reveal on here that have to occur. Right? If it's all of us get taught this, but a lot of us don't do this. You have to make them treat you as if this is a puzzle, have to piece it together, and that takes skill. The reason that put this here because areas that are very weak and cannot take a load is an area of deficit. And then the next question, do all of the muscles move on command when you ask the client, hey, can you move, pat your foot? Can you lift your knee up? Can you kick it out? Can you bring it back? Can you move it over here? Can you move it there? Can you step this way? Can you balance on? Can you do all these things? If you see anything that pops up, that's a deficit. Now we have to figure out the deficit: isometric, concentric, eccentric. There goes the skill. How do I actually strengthen it? How do I make it more of a thing that they can reproduce outside of here? How do I improve the confidence with it? Now, with all that being said, the reason I made this particular um, presentation is because I have multiple clients who have these issues, and I have a lot of great results that come from a lot of clients who have this issue. And what they will all tell you is that it is a lot of hard work for them. It is some of the most challenging things they have ever attempted to do. It really exhausts them. And I wanted them to understand how and why this is the case. So whenever, somebody says that whether it's a doctor or a therapist that you're not going to be able to walk straight again, but you can move all your muscles, that's not true. You can walk better. You can improve your walking. It happens too much. They go to follow-up appointments and the physician or the therapist or whomever, the family member just doesn't quote unquote understand what they're looking at or assessing it probably give a true answer. Because I've talked to people who actually had strokes and they're like, well, I'm trying to get back to walk again. And I do all my assessments. I say, you'll be able to do this, this, and better. This can help you improve your walking, but you may not ever get this back because of what I'm seeing and assessing here. And then I'll have people who can move. And I'm like, oh, you can get that back. Why? You just have an issue with these problems, but you have full connection from brain to foot, brain to hand, whatever. You're just having an issue getting the system to fire and be under your control. Right. So there's moments where you can be truthful and honest and, and be able to say, hey, this can't happen. And then some moments you can say, well, you know, this can happen. But the thing is the assessing, right? So with that being said, guys, that's the end of the talk. I know it's kind of a long video, 15 minutes, but at the same time, that's why we make shorts and we turn around and do the long form in case you want to learn something. So if you're a patient and you see in this video, you can give us a call or go to www.3, that's my bad, www.iii-gen.com/booking. That's a form that you'll fill out that'll get us, to quote unquote, in and get you scheduled, get us to call you, or you can just contact us. Our information is on our actual website. It's on this page. You'll see it in the description, as well as please like, share, subscribe, follow our other places, Instagram, Facebook, so you can see other stuff that we actually post and do. And with that being said, I hope you have a blessed one. I'll catch you in the next one.